Hello, Dr. Childress here, clinical psychologist, walking through Gardner's 8 symptoms of parental alienation syndrome. It's a scary road, let me tell you. Clinical psychologist, my brain is kind of melting out my ears. So we're through the first 2 symptoms. It is scary. We're now into the third symptom. What's the third symptom? A lack of ambivalence in the child towards the targeted parent. The rejection, that campaign of denigration. And there's a lack of ambivalence regarding that. Okay, lack of ambivalence, that's splitting. So you're saying there's polarized kind of, the splitting pathology in the child. Well, dang, splitting pathology, that's only associated with 2 things, splitting. Narcissistic personality and borderline personality. Most often with borderline, but it shows up in narcissistic. We don't recognize it because they never show up for therapy, but splitting is part of the narcissistic personality. Go talk to Kernberg. So, we got splitting. We got borderline pathology somewhere in this family. Yay, we know something. Okay. So now this third diagnostic indicator tells us actually some information. So you're saying that there's splitting pathology in the child. Well, how does a child acquire splitting pathology? Okay, that happens through a very specific type of parent-child interaction in early childhood. That you get an intense cross-inhibitional influence on the 2 networks. Bonding and avoidance are just either goes one way or the other because they're cross-inhibiting each other. It's associated with childhood trauma. Splitting is, and that's why it's associated with narcissistic and borderline personalities. Childhood trauma. So you're telling me the child, your third symptom is the child has splitting, which means either the child is exposed to trauma or we might have more likely a borderline personality parent with trauma history. So okay, that's a good symptom. Okay. One question. Why didn't you call it splitting? Why did you say lack of ambivalence? Now you're confusing things. A lack of ambivalence. If you want the child to kind of maybe like the problem parent, that you're bad, but I kind of still like you, is that what you're looking for? Because if you're seeing pathology, call it what it is. Be a mental health professional. We have language, we have professional terms. If you're calling it, if it's splitting, call it splitting, because then that opens up the whole domain of trauma and the potential trauma in the parent and all sorts of stuff. If you stay with this vague phrase of lack of ambivalence, then all that trauma stuff doesn't get open. All that stuff about splitting and borderline personality and childhood and the type of parenting that creates the neural inhibitions of the 2 networks, none of that becomes accessible unless you identify the symptom as splitting. Okay? So I'm okay with symptom 3, but I'd prefer that we formalize it into splitting. All right, so good. Follow me along. We'll go to symptom 4. I'm becoming a little more optimistic. Yay, we had sort of a symptom in 3. Yeah.